Hi guys, it's Camille from Pareto Education, and in this video we will discuss psychiatric histories. These are very common and you will encounter them in your clinical career again and again. There are a few fundamentals that you should consider in any psychiatric history, and before we go into the crux of the video, I'll quickly mention these. In a psychiatric history, it is very important to develop that rapport with the patient. It is important to let the patient understand and appreciate that this is a non-judgmental, safe and open space. The elements of the conversation that you will have with the patient will remain confidential. It's also very important to discuss with the patient protective and risk factors. Protective factors in terms of what is keeping them safe, anything that's helping them in terms of their mental health, and any risk factors as well that may push them towards. In psychiatric histories, it is very important to ask about suicide risk. Mention the word itself. Has the patient considered harming themselves, even killing themselves? This will not increase the likelihood of them acting on these actions or these thoughts, but it may give you an insight into where their mental space is at the moment and how likely this is to happen. So that's the overall summary, and we'll get into the video now. Hi, my name is Camille. I'm one of the physician associates here at the practice. Can I begin by taking your name and age, please?
Yeah, I'm Alan Jones, and I'm 42.
Nice to meet you, Mr. Jones. Is it alright if I call you Alan? Yeah. You seem a little upset there. Do you want to tell me what's brought you into the practice today?
Well, my wife reckoned I should come here. She thinks I'm not right.
Okay. And how do you feel?
Different to how I normally feel, but just get on with life, don't you?
So tell me, you're saying you feel different. Different how?
Just feel very low.
Okay. Do you feel
That's all really.
upset, angry? Do you feel no energy? How do you?
I just feel empty.
Empty. Okay.
And I just feel low.
And how long have you been feeling like this?
It's been at least about 8-9 months.
Really? Okay. And since these 8-9 months, thinking back, was anything that sort of made you start feeling like this, or was it just all out of the blue? Or?
Well, my mum died about a year ago.
I'm sorry to hear that.
And that's become quite difficult for me to deal with. It's tough because she was very close to me.
Of course.
She still is.
And so since then you've been feeling low?
I suppose so, yeah.
Does your mood fluctuate, or you've been feeling low ever since? Does it? You ever have times where No,
I just feel down all the time.
Okay. And that's the main reason why you want to speak to me today?
I think so, yeah.
Okay, that's okay. As long as feeling low, we'll ask you a few more questions if that's okay. You say you're feeling low in your mood. Are you feeling more tired than normal, anything like that?
I feel really tired.
Yeah.
Yeah, I just feel proper tired.
And your daily activities, are you able to do them, or go to work, chores, these kind of things?
I mean, I go to work, but I'm not really engaged with work. I don't do much at all, to be honest. It's hard.
Okay. And what is it you do?
So I work in an office.
Okay.
In a call center, and kind of I deal with lots of different clients, but I'm just not in it anymore.
In terms of yourself, you say, did you previously enjoy your job? Was that something?
I used to like it, yeah.
Yeah.
I still do, but I can't find myself to get into it. I just feel like I'm not interested anymore.
Is that a common theme, you'd say, within other hobbies and interests you have?
I mean, there's still things that I like to do, like I like to go on a walk. I like it when I'm with my brothers and sisters, but
yeah.
I'm just always empty, and I'm very, I'm just always really tired.
Does it not give you the same joy as it once did, perhaps?
Nah.
Okay. Tell me about a few of the things. Tell me how you're sleeping.
Well, I sleep really late, and I wake up really early, and I'm not sure why. Maybe that's why I'm so tired, Do you feel like the quality of sleep you're getting is, as well as the hours, is not the same as it once was? Definitely not.
Okay. And there's no clear reason why you can?
Just can't stop thinking about my mum.
Which is understandable.
And how life has changed so much over the past 8 months.
Yeah, of course, yeah. It's a big loss for you.
Yeah.
Is there anything in particular about your mum that you used to do? Did you see her every day, or did you see her from time to time?
I used to speak to her every day. She used to live quite far from us, but obviously Mama.
Of course, yeah. I'm so sorry. We can definitely offer you some help, okay? So you've done the right thing by coming and speaking to us, and we can definitely offer you some help, you know, and based on some of the questions I will ask, and then we can see where we can go from here, okay? You've told me about your sleeping. Tell me about your eating habits. Has that changed? Is there any difference with that?
I'm not eating much. Don't really feel it.
No appetite, or you don't get the enjoyment?
Yeah, no appetite.
No appetite, okay. And telling me about, so you've told me, you know, you had hobbies that you're not really enjoying as much. Any sort of other things, some people call them vices, for example, you know, drinking alcohol, has that changed at all?
Not really. Don't drink any alcohol, no.
No, okay. Things like gambling, anything like that?
No gambling, no.
Okay, all right. Anything that you feel that is not, you know, conducive to a good life, anything that's sort of harming you in any way?
I mean, I smoke cannabis.
Okay.
Daily.
All right. And is that something that's new?
It's since you know, maybe the past 6 months, but it's not very small amounts.
Okay.
You know, and it used to be daily, to be fair. It's not anymore. It's probably less.
Okay. And do you feel like you perhaps use that as a crutch, as a way to cope?
Yeah.
Potentially. Okay.
I need something.
Yeah. Okay. Tell me about, you know, I'll ask some other questions as well, just in regards to your mood and things. Have you ever had any periods of sort of elation, sort of very high mood where you're sort of very spontaneous and you feel a lot of energy? Has that ever happened during this period?
I wish something like that would happen, but no, not really.
Okay.
Just feel low.
And some of these symptoms I have to ask with someone presenting as yourself. Have you ever heard any voices that perhaps other people haven't heard? No. Okay. Seen anything like that? No.
No.
Okay. So in terms of yourself at the moment, who else is living at home?
It's my wife and 2 kids.
Okay. And how's that relationship?
Strained.
Strained, okay.
Because of me.
Yeah. Okay.
Don't really want to go out with them.
Yeah.
Go out anywhere, just like to stay at home. And
Yeah. What about other friends and things?
They're around. I see them sometimes and I feel quite happy for a little while, and then it just stays for a while.
Have you spoke to anyone about this apart from myself? No. Okay. Any reason why you haven't?
Don't want to be a burden.
Okay. I'm sorry you feel that. You're definitely not a burden here, okay? And we're definitely here to help you, okay? So during the course of, you know, you've been feeling very low in yourself, and obviously your life has changed since this tragic, you know, your mother passing. Have you ever, you know, during these times, have you felt very low in terms of, you know, even hurting yourself or hurting others? No.
No.
Okay.
I couldn't do that to my wife and kids.
Okay. And, you know, we have to ask the question, you've thought about suicide?
No.
No. Okay.
No.
So you've not made any preparations or anything like that?
No, definitely not.
Okay. I'm sorry, it's just something that we have to ask for these kind of consultations. All right. So based on what you've said, I'd like to ask a few more questions about your background, and then we can go on to sort of think about a plan as well. Have you got any other medical problems? No, nothing you take medicine for regularly, anything like that? Okay. So you don't take any regular medications and no allergies as well? You mentioned some casual cannabis use occasionally, but apart from that, you don't drink alcohol, you said, and you don't smoke cigarettes. Okay. And in your family history, is sort of mental health an issue that you're aware of?
It is, yeah. I mean, my mum had depression.
Okay.
Many of my aunties and uncles do as well, so
okay.
I wonder if this is depression.
Possibly.
Feels like it.
Possibly. Is this something you've suffered with in the past?
Never have, but I've never felt like this in my life.
Okay. So apart from, you know, taking the cannabis, is there anything else that you're using to help yourself?
No.
Okay. And what kind of help particularly were you looking for? Was it just a chat, or what kind of help in total?
Just want to know if you can refer me somewhere or find out what's going on with me, because it ain't normal.
Yeah, absolutely, yeah. From what you've described, it does seem to be depression. And this is a diagnosis, and it's very common, unfortunately, and you know, with the life event you described, that's probably what triggered it. Obviously, grief is something that we all go through different periods of life, but this prolonged period of you feeling very, very low and not getting the same enjoyment out of things, your sleep being affected, your eating being affected, being very low in mood, energy, and like I say, not enjoying the same things as before.
Sounds like me.
Yeah. So with this depression, you look like you do have a family network, but the fact is, many people perhaps don't know how you're feeling so low. So this can be a risk factor, particularly as a male patient as well. That's also a risk factor. Not others not being involved with this as much. So obviously it's up to you, but we can help support you through this rough period. There are a couple of things that are available in terms of services and support. So we do have our grief counselling sessions. There are also men's specific clubs that you can join. These are networks and communities of men like yourself that get together on a regular basis, talk about different things in a sort of safe, confidential environment, non-judgmental of course, and you're allowed to air the problems that you're having, and this for some people really helps. There's something else as well called cognitive behavioral therapy that can sometimes help as well. This therapy with a counsellor or therapist that allows you to talk through your triggers, things that make you feel low, and anything to improve your mood as well. With these talking therapies, there are also medication as well. That's an option when you're feeling so low. So there's definitely quite a lot of options there.
Yeah, it sounds like there's a lot of help that's available.
Absolutely, and it's definitely something we can work with you as a GP practice ourselves. Myself as a physician associate can definitely help you through this rough period.
So what happens next?
So what happens now is according to what your wishes are, what you want to choose.
I think I need a bit of time to think about it.
Okay, that's perfectly fine. So what I will do, I'll book an appointment for next week, and we can discuss it more. In terms of whether we go down to therapy, counselling, group sessions, or even medication. Apart from this, I'd like to give you some sort of advice on, if your mood starts feeling very low, or if you start having intrusive thoughts about perhaps self-harming, hurting yourself in that way, then you can reach out to these crisis teams as well, if your mood is very low. And obviously, within hours, you can always reach us as well, and I'll be more than happy to speak with you again.
Thank you very much.
So I think that's what the consultation will end with. And if you go ahead and have a think about what you would like, what kind of support best suited to you, and then we can go from there.
Thank you.
Thank you very much.